So good afternoon, everyone. I appreciate the opportunity. As Lucinda said, my name is Yolanda, and I do work for the Division of Child Welfare, so I definitely appreciate the opportunity to speak with you this afternoon, and I've identified just a few objectives for doing so. Really wanted to give some insight into child protection information gathering as the Hotline administrator, to speak with you all about how we gather information when somebody does call in a concern about substance-exposed newborns, and so go over that a little bit, as well as talk about what we've learned about the population when there have been concerns regarding substance-exposed newborns, what we've learned as far as the data we've gathered recently around that, and then also what's the impact to our decision-making process. So I'll speak to you a little bit more about our red team process, which was mentioned earlier in Angela's presentation, to kind of talk about how those discussions look and how we utilize the information that many of you may call into us when you have a concern to report in that next step decision making. Okay, so I wouldn't be doing my job if I wasn't just at least reminding folks about being able to contact social services or departments of human service when you do have a concern involving substance-exposed newborns or any child abuse or neglect concerns. So as we know, anyone can make a report when they do have that concern, and in particular, I imagine most of you in this room are mandatory reporters of that in Colorado. Would you raise your hand if you do know that you're a mandatory reporter in Colorado? Yeah, so pretty much everyone in the room, which is what I anticipated. And so just as a reminder, when you have that situation where you might encounter either knowing or suspecting that child abuse or neglect is occurring, which can include substance exposure to newborns, then to have to make that report to one of three agencies. And so generally for child protection, the way information will come to us about substance exposed newborns are when mandatory reporters in particular, also those sometimes concerned community members or family members, will call either to the Department of Human Services or to our state hotline, or sometimes even it involves law enforcement, depending on the situation. And so when we do have calls to law enforcement, they'll cross-report to child protection. And as a state, our hotline system, which encompasses both the state hotline as well as the county departments of human services, their public-facing hotline numbers takes on average about 220,000 calls per year. And so with that volume of calls, we've been able to really take it as an opportunity to say we want to learn more about different populations that people are calling regarding concerns about. And so one of those populations that we're here to talk about today, of course, are substance-exposed newborns. And so part of what we saw as an opportunity regarding substance-exposed newborns, not only to identify them as a population, also though to ask questions that can help us understand what are the concerns involving that child or that substance-exposed child. And so what we did is really look at information that other states have asked questions about, things that just generally we wanted to know about, and really what could impact the child. So what makes the situation either more challenging for a caregiver in that situation caring for an infant, or could help be a family strength or support or resource for them. And so we really looked at questions around what, if any, withdrawal symptoms is that infant that's been exposed to substances or suspected to have been exposed experiencing, what if any physical impairments or medical complications might be occurring. We also wanted to look at what resources and referrals have been offered to the family, because that again can often mitigate some of the original concerns that are being shared with us. And then of course what we're here to talk about somewhat today as well are the plans of safe care, and has that been done with the family, and what would it be good for child protection or child welfare to know about those plans of safe care. And then about bonding and breastfeeding, because again, as we're looking at what is the right intervention potentially to have with the family, knowing information in these areas really helps us make some of those next step decisions and a plan that we can work with on the family. And so we did take this opportunity with substance exposed newborns to ask these specific questions. And two of the handouts that you have in the electronic handouts that were shared for you for this day of training, one is our general information gathering guide, which just goes over the general questions that we ask anyone who's calling in a concern about a child or a youth. And then another of the handouts is specific questions about substance-exposed newborns that we would ask if that was the reason that you were calling. And so again, it gives us a picture of not only what we would want to know about this population, also then what we need to consider in our decision-making moving forward. So since, again, we took the opportunity to be looking at this population, since August of last year, we've had, 773 reports where that's been the identified population or child that's being called in about is a substance-exposed newborn. And that was a newer classification essentially for a report, so that's where our data stems from that I'll be sharing with you over the next couple of slides, is basically from August of last year. Prior to that, we were looking at children who were exposed to substances, and that could have been in the home, that could have been as a teenager, and so we really wanted to narrow the focus of understanding substance-exposed newborn population specifically. And so again, we've had 773 referrals called in, and I think one of the interesting facts is who are calling in those referrals to us. And so you see up there, the majority of those referrals are called in to us by hospital social workers. And I think that's often because in consult with physicians or nurses or other medical personnel, then the social worker sometimes is the one who has the opportunity to ask some questions of the mother, and then potentially some additional questions of the mother, and then potentially make that report to child protection regarding the substance exposure to the newborn. We also have had in our report breakdown of who calls in around substance-exposed newborn, about 12% are nursing staff and 11% are other hospital staff, and then other medical personnel, physicians, make up about 4%. So that's kind of the breakdown with who's calling in the concerns regarding substance-exposed newborns. So this is what the breakdown of the initial concern for substance exposure involves with calling into child welfare or child protection. So this doesn't mean that it is absolutely the substance the child was exposed to. It's just what is suspected, or maybe what that, if there was a preliminary toxicology test done, what it might have come back positive for. And so I was having a conversation with the person I'm sitting at the table, like, is meth making a comeback? I've been hearing that as a rumor, and our data would show that it is, or maybe it's never gone away, that we see beyond marijuana as, of course, the primary substance that often children or babies are exposed to prenatally, that methamphetamine is the next highest. Again, that the suspicion of the use of methamphetamine prenatally at 21%. We see like heroin at 6%, we see alcohol at 2%, unknown at 1%. So again, when people are calling us to share their concerns about a substance-exposed newborn, these are the type of substances that they're saying they believe that the child has been exposed to prenatally. And it could be multiple substances, it could be more than one in that percentage breakdown. So I'll just pause there for a moment, just like in case you need a moment to just look at the different percentage breakdowns. And just maybe by like nods or a show of hands, does this seem familiar to you in the settings as far as the substances that you are seeing prenatally children being exposed to? Does it kind of align with what you're seeing in those of you that are medical professionals? Like I see some head nods. Yeah, so we're seeing like maybe more cases of meth, maybe a few less cases of heroin because of a lot of the resources that have been dedicated to opiate and opioid exposure. Okay. So in regards to plans of safe care, because this is a little newer for us as a state, and hospitals are working on what those requirements look like for them with the Comprehensive Addiction Recovery Act. When we've asked folks who have called in around substance-exposed newborns to our hotline, when we've asked them whether a plan of safe care has been done, we've gotten about a third of the time the answer is yes. And so I imagine as we're a state moving forward, as a state in Colorado moving forward with plans of safe care, that we'll see that number continue to increase. One of the things, though, that I think would be a variable in this data report out would be, does someone know what a plan of safe care is? Meaning the person who's the call taker on the hotline or the person who's making the report. So if they're less familiar with what is actually a plan of safe care, they may answer, I don't know, or no, if they don't know. And so one of the things we've tried to do on our side in preparation for asking these questions and for learning more about substance-exposed newborn population is to have in our system hover help that describes what a plan of safe care is. So if the caller were to say, I don't know exactly what you mean by that, we could say, well, this is what we know that it is. And so that way the person could answer that question a little bit more informed about what a plan of safe care is. Okay. So I think when we're talking about substance-exposed newborns, I think one of the things that's important is for us to know about what resources, if any, have been offered to the family. And as mentioned by several of the presenters this morning, there are a lot of programs and resources and connections that hospital or medical personnel make with the family in order to help upon their discharge be connected to resources that might help mitigate some of the complications that are experienced when there's either a substance use disorder or somebody is struggling with substance use in general, and then the stress on top of caring for a newborn baby. And so when we've asked the question about resources being offered as a yes or a no, almost 30% of the time people are saying yes, there have been resources offered. And I imagine that that actually would be a higher number. So as the Hotline administrator, one of the parts of my job is to think through, like, what are better questions for us to ask to get to more information so Child Protection and County Departments of Human Services tasked with child protection can have more informed decision making and build on the strengths and the resources that medical professionals are offering to the family and working with them upon discharge from a hospital, for example. With infants experiencing withdrawal symptoms, the answer to that was 7% of the time yes. And I think that it would actually be higher as well. I think sometimes what happens is that reports are made pretty quickly after the birth, or even immediately after the labor, because either the mother has disclosed verbally or there was a test prenatally that's in the medical record or something has indicated that this child has substance exposure. And so when we're getting those reports, as we should, as soon as somebody has a concern to call us, there may not be enough information from the medical side of things to know whether the child is experiencing withdrawal. So of course, me not being at all a medical professional, I don't know at what period of time do withdrawal symptoms sort of set in, if any, when they're observed in a child who may be exposed to substances prenatally. And so I imagine if we were to get that call, talk to the same staff person 24 hours later, that number may increase with saying, yes, we've noticed some withdrawal symptoms. And I think there was a slide earlier in somebody's presentation that was showing the tenseness of one of the babies, that different types of symptoms that they may be experiencing may not be known right away. And so these questions, whether resources were offered or is the child experiencing in withdrawal symptoms, again, is trying to shed light for us on this population. And in particular with is the child experiencing withdrawal symptoms, to understand what those might be and what, if any, medical intervention is necessary. And part of what we're trying to accomplish in understanding that is that if a child is experiencing withdrawal symptoms, then they may be harder to console. So the eat, sleep, console, right? They may not be sleeping as well. They may be harder to console. They may have feeding issues. And those are all things that can add to the stress of a caregiver. And so us knowing that those may be challenges the caregiver is facing, then it can help us understand what might increase the risk to this very vulnerable infant in the care of that infant if they are experiencing those things, such as withdrawal symptoms. And then also what potential education or, again, resources the hospital or medical personnel have been able to connect the parents or the mother with in that situation to help address when there are sleeping issues or feeding issues or challenges in consoling the baby. Okay. So this is what Angela referred to in her presentation around the RED team and the review, evaluate, and direct. And so this is what is the framework. So she kind of described or gave a verbal example of how it's utilized. So I just wanted to be able to share it with you all. So I'm not sure how easy it is to read. Hopefully you can read some of it, and I'll go over some of it. So when there is a concern regarding a substance-exposed newborn or any concern of abuse or neglect of a child, and that report is made to us, and we do the information gathering during the hotline call process, and we ask as many questions as we can to try to get as much information and an understanding of what the concern is, as well as what strengths exist in the family, and try to again assess early on what is the concern and what might need to be done about it, right? So we're gathering all of that information on the hotline side of things, and then after we take that report, including asking the substance-exposed newborn additional questions, then after we gather all of that information, then the next step is for child protection, child welfare at the county department level to make a decision of what level of intervention, if any, is going to occur with the family. And so to not do that in isolation, or to have that be the responsibility of only a single person at the county, as a state, we utilize this red team process. And so it gets to be a more dynamic decision-making process, which involves multiple people at the county level. And then, as mentioned, some counties have even incorporated involving other medical personnel, like nurses that do nurse-family partnership, or other medical professionals or school staff. There have been ways that counties have been creative in being able to bring in other professionals that can help inform that next step decision making. And so in the red team process, the counties are meeting, depending on the size of the county and the volume of referrals that they have, they may be meeting multiple times a day, they may be meeting once a day or several times a week to go over and review the referrals that they've received regarding concerns for child protection. And so in doing so with the framework, it gives a consistent way to map out those decisions. So again, it's not done in isolation. It's not just based on one person's sort of gut instinct. It's really a process and a strategy to say, how are we going to make this decision moving forward about the seriousness of intervening with a family? And so when child protection intervenes with a family, that is a pretty serious situation. We're getting them involved in a child protection system that may result in a temporary removal, that ultimately could result in termination of parental rights. All the things that people, professionals, and families themselves are scared of from our system, those things do happen, and yet the intention is really to be able to help support the family and provide enough support and resources so the parents or the mother in this situation with substance-exposed newborns can provide that care that they want to for their own children within their own home. And so what we're looking at, let's say for example with a substance-exposed newborn, that's the reason for the referral. So the reason that you may have had to call in is because there was a positive test or a disclosure about substance exposure. And so then that's called into us. And then what we're looking at is, has any harm occurred to the child? So at that point, maybe we don't know enough information to know whether actual harm has occurred, yet there's danger. And the danger would be like, what is the likelihood that harm could occur if there is no intervention or nothing else changes or maybe gets worse? We also look at complicating factors. And so complicating factors could be that maybe the substance use disorder is getting worse for the person. They haven't really wanted to seek any other type of help or treatment for it. Maybe there's a criminal case going on. Maybe the person is homeless. There are a lot of things that could really exacerbate a situation or complicate it more. Child welfare history, if there's been prior issues around concerns that are similar, that could be a complicating factor. So we really look at that left-hand column as, what are we worried about and why were you worried enough to have to call us? Then on the right-hand column is really where the strengths and protective factors live. And so we'll ask questions or want you to provide us information with what is working well. So maybe there's extended family that's come to the hospital and have been a support to the mother. Maybe hopefully there is a father or another partner involved, and so there will be more than just the mother in the care of the infant, because of course that's challenging to care for an infant as a single parent, I imagine. And so the other strengths or protective factors could be that the mother is interested in resources or inpatient treatment or going to a program like we just learned about. Those would all be strengths. And the plans of safe care are going to also be, or safe discharge plans are going to be things we want to build on as well as strengths, and really work on what are those protective capacities and how can we wrap around services both from the community side of things and the child protection side of things to build again on those protective factors and the safety in a positive way for the family and the child. And then in the middle, so that's like what's working well essentially, or what we can build on the right column. And then in the middle is really what are the gray areas, what are cultural considerations, what are things we don't know that we wish we knew about the situation, to if we are going to intervene with a child protection assessment, then what do we need to learn more about in order to properly resource and support the family. And so we map all of that information out in this red team process and then have this dynamic discussion. And so So what's helpful is that people come from different lived experiences, they come from different professional experiences, and can really lend that to the conversation to say, this is one of our most vulnerable populations, newborns and infants. They are 100% dependent on the care of a caregiver. And so when we talk about that, how does that increase the stress, or how does that potentially mean that the resources available will help support the family in being able to meet the needs of that newborn? So we have that dynamic discussion, and then we determine the next steps, which the next steps could include assigning that referral that we have for assessment. And so that would be, some people have referred to that as an investigation. For child protection, we really don't do an quote-unquote investigation. That's more of a law enforcement function. We do an assessment, which means we're going out to better understand the family and then be able to know what resources and supports we can help provide that may address the original reason for the referral and the danger harm that might exist. So we can assign something for an assessment and go out and do an assessment with the family. If it doesn't meet the criteria to assign something for assessment, then we can also refer the family to prevention services, so voluntary services that they can also access in addition to whatever resources and referrals have been made on the hospital side or the medical professional side of things. So I wanted to just spend a few minutes with this framework and kind of describe a little bit more what that process looks like, because I believe it's one of the less familiar parts of reporting that you all are required to do if you have that concern. To, like, what does that decision making look like, right? I kind of think of the Wizard of Oz behind the curtain. Like, you have a concern, you call it in, we ask you all these questions. You may or may not know whatever happens to that report that you call in, and may not know what that decision-making process looks like. So I just wanted to spend a little bit of time to go over it so it becomes a little more familiar and you understand how we take the concerns that you share with us on a daily basis and be able to have the discussion and determine what those next appropriate steps are in potentially intervening with the family. And then if we do accept something for assessment out of that red team process, I think another part that might be a little less familiar to professionals in the room or to medical professionals in the room is, what does that assessment really look like? And so I just wanted to take a couple minutes to share that information as well. So if we were to get a report regarding a substance-exposed newborn, we make the decision that we're going to accept that report for further assessment. It's assigned to a social caseworker, and they're going to go out and complete that assessment with the family. What does that all look like? And so this is just to give you a little idea of what that assessment will look like, because while it will focus primarily on the substance use and the concern with potentially the ongoing substance use of the caregiver and potentially the concern or risk to the infant in that situation, it's a global assessment though. So we want to look at different aspects of the family situation that may also be either complicating things further or other situations where we might find safety concerns or areas where there might be strengths going on. So again, caregiver substance use will be looked at. We'll look at areas if there's any concern for domestic violence within the situation in the family. What are the discipline practices? And I should say too, if there are older siblings, they would be part of that assessment for the welfare, the safety and well-being of those children, all the children in the home of that household. So of course the newborn and then any additional children in that household. What protective capacity is there? And that's where you can really help us understand what you've observed or what your interactions with that caregiver have been like. So if there's bonding, if there's, if you're being able to provide some education to the parent, especially if it's a new parent, around, again, that sleep, eat, console, all of those things would be around those protective capacities that a parent is capable of. What's the child's functioning? What's the general living situation? Is there anything that could be environmentally hazardous to the child? What, if any, medical or mental health needs exist? And that would be both for the children or for the caregiver. Any physical injury that's occurred, and what's the level of supervision? Because I think one of the concerns that sometimes go hand in hand around substance use is supervision, that if somebody is using substances and they're the sole caregiver for that infant and the substance makes them incapacitated for a period of time, then again, an infant being completely dependent on their caregiver, then supervision becomes a concern concern and whether that can be adequate if there's not a sober caregiver in the home. So that's one of the other aspects of an assessment that is done. And then if we find any safety concerns, meaning there's current or impending danger in any of these areas, then we're trying to intervene potentially with the safety plan for the family. And if that cannot control for the safety concern, then that's what's been spoken to earlier about. There are times when a temporary removal from the home is necessary in order to help stabilize the caregiver and to also meet the needs of the very vulnerable infant in that situation while we work to address what is the safety concern and hopefully quickly resolve it so we can return the child to the parents in that situation. And part of our assessment process is always trying to understand what is the impact to the child. So not just that there was substance exposure, what about that exposure is impacting the child? Their safety, their well-being, the ability of the caregiver to supervise them, anything else going on in the situation. Again, what is that impact to the child? So that as we understand what that impact is, we're again working with the family holistically as much as possible to address those concerns and what that impact is, or help the caregiver even understand what that impact could be so that we can meet the needs of that family and help that family to improve the situation so that the child can be in that situation and not have to be removed or can be returned as quickly as possible. So that was just me wanting to give you some information about kind of what that information gathering process looks like when it's a substance exposed newborn concern, how we take that information that you share with us and make that decision through the red team process, and then also what that kind of give you just some insight into what that assessment process looks like, because it's a hard job that you all have in working with families and trying to help address all of their needs, as well as it's a hard job Child Protection has to determine when is it appropriate to intervene with a family and at what level of intervention is necessary to mitigate those safety concerns and to ensure that moving forward the child won't be in a dangerous situation where harm can occur.